Right, good afternoon, everybody. My name is Chrissy Murphy. I'm the Chief Marketing and Membership Officer at the CPA. I'll be moderating today's session. During today's webinar, we'll be hearing from both the President and the CEO of the Canadian Physiotherapy Association about the latest impact of COVID-19, our next steps, and the things that the CPA has been working on. We will have an opportunity for you guys to ask and answer questions. You'll see there's a Q&A button at the bottom of your screen where you can answer or you can send questions. They'll come through to me and I'll be able to moderate those to the two panelists. If you have any other questions that don't get asked today, we do have a limited amount of time. You can always contact the CPA at information@physiotherapy.ca, and we're happy to take questions that way as well. We are recording today's webinar. It will be available on our website under COVID-19 webinar series on our physiotherapy.ca/COVID-19 website. So I'm going to turn the session over to start to Viivi, the President of the Canadian Physiotherapy Association.
Thanks, everybody. Chrissy, can everybody hear me, do you think?
Loud and clear, boss.
Okay. Hi, everyone. Thanks again for taking time out to join us on a Sunday. I'm really honored to have a chance to engage with CPA members, hear from you about your concerns, and receive feedback related to the current climate, the association actions, and the perceived future for the profession. It feels like it's been a month since I last addressed the membership, but it was only a week or so ago. But the rapid pace of information and change has continued. As I said previously, we are in uncharted waters as we as a profession find our footing and define our role in the COVID-19 outbreak. Since we last spoke, things have changed. As anticipated, Canada's situation continues to escalate, and the strength with which the government is enforcing physical distancing has increased. And with that, the physiotherapy profession continues to change along with it. I've been spending my days, like many of you, triaging which of my patients have urgent need for treatment. I've had to use my PPE to ensure my clients continue to receive care. Having said that, the organization I work with has also had to undergo a series of layoffs. As the president of the association, I've been working with staff to identify what the future will look like for physiotherapy in Canada. We need to help our members now, but we're also considering how will we have to help our members in the future. We don't want to be passive recipients of the new post-outbreak normal for physiotherapy. We want to help decide what that future will look like. Daryl Yardley, one of our private practice members, has made a comment on CPA's webinar this past Thursday, and it struck me. He said, in essence, we're redefining the profession overnight, and I couldn't agree more. For fear of sounding opportunistic, and with respect to those of you who continue to struggle with businesses closed, and physiotherapists and physiotherapy assistants laid off across the country, we do have a chance to use the changing pace in the system to drive our profession forward. In a single week, the CPA has been able to influence decisions on policy that we've been working on for a decade. We see evidence that insurance companies are recognizing the value of physiotherapy. We see government listing urgent and emergent physiotherapy as an essential service. Insurance companies have agreed to cover virtual services. The Public Service Health Care Plan suspended the requirement for medical referral for physiotherapy services. And our peers have demonstrated in hospital settings that physiotherapy is a reliable, cost-effective way to decrease inpatient length of stay in hospitals. I know we're still afraid, and the impacts of the outbreak on business owners, physiotherapists, and Canadians cannot be understated. We aren't foregoing our responsibility to help in the crisis. And we're still not at the peak of this. We're working with previous CPA President, Dr. Mike Landry, and physiotherapist Phil Shepard on understanding CPA's role in this outbreak. We're assembling, with Phil and Mike's help, an emergency response plan with related resources. Keep an eye on our COVID resources page to stay abreast of new initiatives. We want to ensure that the success physiotherapists are having in hospitals in Nova Scotia and PEI by contributing to management of the outbreak in acute care settings can be replicated and realized across the country. But with that said, we do have our eyes looking forward. We want to help. We know we have a role to play, and we want to drive change in the profession so that our contributions to the outbreak can strengthen the profession now and for the next 100 years. Chrissy, back to you.
Thanks, Viivi. I'm going to turn it over to JP for a few opening remarks from the Chief Executive Officer of the Canadian Physiotherapy Association. JP, you're on mute.
I did that last time. I think we can all agree. I was in a meeting yesterday with some of the other CEOs of their health associations, and one had commented that this last 2 weeks has been the longest 6 months of my life, and I think a lot of us can relate to that. And it's not over. We have still lots to do, but I do want to start by saying that I think as members, as staff, as a profession, we are very lucky at this point to have this board, Viivi as president. The amount of work they've done with us and our partners to ensure that from our crisis plan perspective, the recommendations, the work we're doing for government are all moving. They have done a fantastic job in supporting us and driving things forward. So I just wanted to kind of put that out there to make sure that members know that you have a strong volunteer base on the board that are doing their job and doing it extremely well, better than some I've ever seen before. So Viivi, thank you. Now, in terms of what we're doing right now, there's a lot going on. There's a lot of other stakeholders that we're dealing with. The most complicated element, I think, of crisis management for the CPA in many ways are the relationships and the stakeholders we're dealing with on an ongoing basis in terms of defining roles, moving projects forward and initiatives forward. We've been working with branches, the Canadian Alliance of Physiotherapy Regulators, educational institutions, other national health associations, the Canadian Life and Health Insurance Association, and obviously the federal government. It's a complicated web, but we're proud to work alongside and navigate a complicated reality with those partners, knowing that we're all kind of moving in the same direction and trying to achieve the same objectives. Now, further, we are actually, I mentioned the board, but we have so many different volunteers that are working with us on a day-to-day basis. Our divisions, clinical specialists, business owners, academics, they've been so supportive in terms of helping to write content, run webinars, provide advice and reviewing advocacy materials, meeting very insanely short timelines to get things out to the members. And what it amazes me the most when I think about what they're doing on a day-to-day basis, they continually come back and they ask, how can we help more? It's amazing to see how this community comes together, how smart you are, how passionate you are, and how you are able to do the type of work you're doing with us at the same time trying to keep your own jobs, your families, and everything else going. It's a testament to this profession, what you do. I do want to do a quick shout out to our partners at Gowling, our legal firm, and BMS, our insurance broker. They have been working night and day, not just with us, but the other health associations to provide the resources, information on what's going on around different areas that we need to know as soon as possible. So they've been with us day in, day out, 24/7. Now, having said that, I don't want you to think that everything is hunky-dory, that we're done. We are just in the beginning stages of this outbreak, and we have a lot to do. However, I do want to demonstrate that within the context of what we're trying to do on a day-to-day basis and more longer term, it's an intricate web of relationships, of work, of levers that you're pulling and pushing to try to move our needs forward and meet the needs of our members. So there's a lot going on in the background. In that context, what we're doing at CPA is we're focusing around 3 different core principles or objectives. We're advocating for the profession, we're informing our members, and we're equipping our members to be ready for what's happening now and what's coming down the pipeline. Viivi mentioned earlier we had some significant wins on the advocacy side, and I do want you to know that our advocacy team is in regular communication with the government, our third-party payers, and members to ensure that we're visible to these decision makers and influencers, and we're at the table when discussions are happening. Even just Friday, I was on the phone with CLIA, the Canadian Life and Health Insurance Association, running through some of the things that are happening within their member community, and obviously advocating for what the needs of our members are. As I mentioned, EQUIP is another critical element of our approach. On the emergency response side of things, we want to thank Embodia, our cardiorespiratory division, who late last week pulled 4 courses related to cardiorespiratory physiotherapy out from behind the member paywall, and now it's open to open access for everyone who wants to go through it. So check out our website; those resources are posted. We're doing our best, and we're making sure that anything we have is not just open to our members, but open to the community at large. We also want to thank the Private Practice Division, who have hosted 2 very lively webinars to support physiotherapy business owners across the country. We're working with them to try to do more as we move forward. And we look forward to, over the next couple of weeks, releasing more content intended to help all of you on the front line, both do your job, stay resilient on a day-to-day basis in terms of all the hardships that some of you are experiencing, and making sure you're, again, equipped to see this through and be stronger when we kind of move out of this. All of these efforts are actually supported significantly by our communications team, who leads the inform element of the approach. So whether it's providing regular updates it seems like minute-by-minute changes that are going on, whether it be in government, insurance, or otherwise, out there in our environment, sharing webinars, providing updates on advocacy, and actually supporting the advocacy team in terms of information flows and competitive intelligence and what's going on. They've done an outstanding job of building, I think, one of the best hubs of resources and information across all the health associations. So if you haven't had a chance, check out our website. The COVID-19 resource page is very helpful. Again, I don't want you to think that, I'm going to keep reiterating this all the time, but our job is not done. I mean, we've heard from you, and we continue to hear from you on a daily basis of the issues you're dealing with, and we're trying to react as quickly as possible to make sure you have the information you need, the tools that you need, and we're advocating on your behalf to help you. So I'm looking forward to having this discussion, opening things up, and hearing what's going on with each of you. So without further ado, I think we can move on to the next part of the session.
Perfect. Thanks, JP. And thanks for both Viivi and JP for kicking it off with a bit of an address. Just a reminder, if you have questions, the question and answer button at the bottom will allow you to submit a question to the panelists. So feel free to go ahead and use that right now. We do have a few questions coming in here from the membership. I think one of the ones that we're hearing a lot on the membership team is with respect to the 100th anniversary. Congress 2020 was canceled. Just asking, are we still going to see some of those initiatives roll out? So I'll let you guys decide, Viivi or JP, if somebody wants to take that one. Viivi, you're on mute.
I'll start, and JP, you can perhaps fill in. So we're committed to celebrating the profession, but we feel that it would be insensitive to get into some sort of celebratory mode right now. So our staff are working really hard to identify alternative delivery models for our content that we had planned for Congress. But right now our emphasis is really on advocating for, informing, and equipping the profession through this challenge, and also beyond. As I said here, I think that we're moving into a new reality for the profession. I think it's going to be better. So we're really focused on that. So many of the projects related to Congress will remain on the back burner for the foreseeable future. But once we've sort of gotten through this immediate crisis, we're going to regroup and we will definitely let everybody know. We would like to have a celebration this year, and we want to have a bigger celebration for 101. So I don't know, JP, if you have anything to add to that.
I think, around the machinations of what's happening, I think you hit the nail on the head. And I don't want to kind of be glib about this, but I think as much as we are not moving forward on some of those 100th anniversary celebrations, I think it alludes back to what I said earlier about the membership and the profession. I think we're seeing the best of who we are. And and as much as this is a game changer, it is shocking everybody. We are seeing the best of this profession right now. And I think in some ways that is a celebration of what physiotherapy and who physiotherapists are. So I think people should be proud in that context in the 100th year. So.
Thanks. We are getting a couple of questions about business interruption insurance. Not sure, JP, if you want to speak to any updates we have on the business interruption insurance piece.
I think there's a couple things from what I've been hearing, and one thing I do want to clarify is that BMS is actually our broker. They're not the actual insurer or lender. So they actually work on CPA and the members' behalf. So they've been advocating for us on what's been happening in that area. For those of you who haven't been through the resource pages, we technically, CPA is not legally allowed to speak to the policies. There is a phone number that you can call BMS to find out more. And we actually did have a webinar last week that you can watch online that will provide more information around those questions. So I would encourage people to call BMS as well as watch the webinar.
Thanks, JP. Another question that we're getting asked about is PPE, and both what the association is doing to ensure physiotherapists have PPE, as well as any technical recommendations around it. I don't know if Viivi, as the physiotherapist on the call, you'd like to take that one.
Yeah, I'll start with that. CPA this is not something we have access to. We are not in a position to access PPE resources, but we're working to figure out how physiotherapists can get better access. We have included key messages related to PPE in our advocacy efforts with the federal government, with emphasis on the acute care settings, but of course, supply conversations are all being managed by the Government of Canada. I saw today that there's an influx of PPE coming in from China, so I'm not sure to what extent that will help. And we're also speaking with our cardiorespiratory division and people in the cardiorest field to make sure that we can push for physiotherapists having access to PPE in the ICU types of settings where there's greater risk. JP, I don't know if you have anything to add.
No, to your point, I mean, it's in those discussions we're having with across government, whether it be with Minister of Health, Minister of Small Business, Finance. It's on that list.
Great, thanks, guys. There are some questions here about what the CPA is doing to protect small businesses, specifically. Just wondering if we've had any direct contact with the government about eligibility as small physiotherapy clinics, how to apply for funding, all of those different questions.
Yeah, we've been in direct support. We're actually right now, I mean, I think you've seen a lot of what's been coming out. The government has been fairly proactive the last little while with the Canadian Emergency Response Benefit that just recently came out, the updated wage subsidy announcement. We have been in ongoing contact with, as I mentioned before, the Minister of Health's office. We're looking to set up a meeting with the Secretary or Minister of Health, Minister of Small Businesses, which this would fall under, in finance. So we're setting up and in contact with those departments. I'll also add that we're working with the other national health associations and have been working through as a coalition on these as well. So it's not just the CPA that is working on this. We're working together across health organizations to make sure that from a business perspective, our members are supported and we're part of any announcement or any incentive or programs that are launched.
Great. Thanks, JP. A question from another attendee. What impact do you think this crisis is going to have on current second-year students in both the short and long term? So I know we haven't spoken much about the education system at the beginning here, but maybe some thoughts from you, both of you, on the implications for students.
I'll start and allow JP to add. It's my understanding that the universities are scrambling very hard to continue programming for students online. There has been a lot of change made regarding scheduling of clinical placements. So a lot of that is up in the air. And also, I think the regulators are working towards making exams available online, and of course the schools are working to have the exams available online. So I think they're working very hard. There's a group that we liaise with, the Canadian Council of, I can't remember the name, it's CCPUP now, Canadian Council of Physiotherapy Programs. In any case, they're working together and staying in touch with us. But as you probably realize, we don't have much control over how the schools are managing the programs. JP, you may know more.
Actually, I would speak to Katya, who is the CEO of the Canadian Alliance of Physiotherapy Regulators. We actually had coffee on the phone on Saturday morning. So they actually, as a group, had meetings on Friday. They're going to continue meetings on Monday. They're trying to work through that whole, it's not just second year, it's the new group coming in that they're still looking at applications, and it's the first year. There's a bit of a, how do they manage that whole, I don't want to call it a glut, but how do they kind of move people through as efficiently as possible? As you mentioned, and again, I won't speak to these things, but they are discussing like the exam and what they need to do and how they can kind of move things forward. So I would suggest, well, first I'll say they are actively discussing this and looking for solutions. I would call your provincial regulator or CAPER to find out more.
I think there's going to be a demand for physiotherapy once we're past this crisis. I recently heard that there was a JAMA article that suggested that 20% of people who recover from COVID end up with cardiac tissue damage, and of course there's going to be a variety of respiratory outcomes that may need to be addressed. So I think there is going to be a need to continue to get physiotherapists graduated and into the workforce.
Great. Thanks, guys. We do have a question about what insurance companies are covering telerehab. I know that we are in the process of creating that list, but maybe JP, if you want to, or Viivi too, if you want to speak to some of the advocacy efforts that are ongoing with respect to insurance companies and telerehab.
I'm going to defer to JP on this one.
Yeah, again, so there's different levels of this happening. It's not just CPA. The branches locally are doing an amazing job of reaching out to the individual insurance companies, trying to find out more around, again, the landscape is changing day by day. I know there was a list of a few that, I think it was Friday, that have announced that they're going to be covering telehealth. We are right now working mostly at the national level through CLIA, again, the Canadian Life and Health Insurance Association, because they oversee, or all their members are the major insurance companies across the country. We are working with branches right now. Some of our staff are working with their staff to collate a broader list of who's covering what and trying to maintain that over an ongoing basis. I will say that the private practice division has done a really good job on their Instagram account of tracking that and providing ongoing updates. So I would check out private practice division Instagram account to see what's happening on right now.
Yeah, and for those of you who don't know, it's at CPA Private Practice. Kareem is on there every day. Lots of great stuff. So make sure you check out that Instagram page because they do have a post collating a list of insurers right now.
Chrissy, can I add one thing?
Of course.
So also the property and casualty insurance industry. So for those provinces that have private insurers, the Atlantic provinces, Ontario, Alberta, Insurance Bureau of Canada is looking at issues related to covering telehealth. But one thing to keep in mind, insurance is regulated provincially. So different provinces may have different approaches to this, and each individual insurance company can make a decision on their own to cover tele-rehab. So don't wait for CPA to sort of get a blanket statement around it. To your insurance company, insurance adjuster, just say, I want to do this, will you cover it? You may get some yeses. So don't give up on that communication on a case-by-case basis with the insurance adjusters.
Great, thanks, Viivi. The next question we just came in here is, how closely are you working with international physiotherapy associations?
Oh, Viivi, yeah. So I'm having weekly calls with the Americans, UK, as well as Australia. They are groups that, quite honestly, they have a fair bit of resources, more so than us, and we're looking at ways that we can leverage what they're doing that makes sense in the context of our system. We're sharing advocacy strategies around what's happening. Some of their governments have been a bit faster on certain things, so it's allowed us to see where we could go. I think some of that work we're going to do around the emergency preparedness with Mike and Phil. They're doing work with the APTA, so there's some things we can leverage there with the APTA. So there's a fair amount of discussion going on between the different international groups.
And recently, an international group of cardiorespiratory physiotherapy researchers pulled together an international guideline on physiotherapy management of COVID cases. So that's available through the CPA website as well.
Great. Kind of leaning into that, maybe, Viivi, do you want to speak a little bit to what the CPA is doing with respect to managing the outbreak or supporting the management of the outbreak as an association?
In terms, okay. So, yeah, so if you haven't already signed up, several provinces have requested physiotherapists who are unemployed or otherwise available to roster as a healthcare professional that is prepared to be deployed in the acute care setting. So if you haven't already done that, sign up with your regulator. A lot of professions are relying on retired professionals, but private practice physiotherapists can roster to help in the acute care setting. And as we've said, we're working with humanitarian crisis response experts, Phil Shepherd and Mike Landry, to understand and define how to support acute care efforts quickly and effectively. So you're going to be seeing more resources from Mike and Phil on our website. We're already seeing success in areas of the country. In Nova Scotia, physiotherapists have been able to mobilize inpatients and get them out of hospital, freeing up space in acute care settings. So I just want to take a moment too to send a virtual congratulatory handshake to our colleagues in the East. That's really a great illustration of the value of physiotherapy. And I'm sorry, that sounded a bit mercenary, but I still think it's a good thing. We're also working with our cardiorespiratory to provide access to content, including 4 courses that we've made available through Embodia. These are open courses available through our site, and we're going to be releasing more training over the next week. So I think this is a place where CPA has a big role. We really want to support our members, ensuring that we're respecting our scope and the role of the regulator, the ministries of health, and other partners in this fight. So there's a lot happening on this landscape.
Great, thanks for that, Viivi. I just want to also echo that Mike Sangster, I believe is his last name, is going to be on a webinar with Phil Shepherd and Mike Landry immediately after this one at 4 p.m. Eastern. So if you want to hear about some of the stuff that they're doing in Nova Scotia, I'd be really little plug for their webinar that's happening right after this one, if you are webinar junkies at this point. An additional question, JP, can you maybe speak to, there's a couple of different questions I'm going to try and capture in here. About applying for financial funds, basically what CPA is doing from a small business perspective, and making sure that people understand and know how to access things like the CERB, all of those different pieces.
Again, we're working closely with the government. I would say that, keep checking back to our website. We are constantly updating what's available, what's there. So part of that informing piece is we're pushing things out, but I think at the same time, it's important that everyone kind of take a bit of time to check out what's going on. And we should have up-to-date information on an ongoing basis through the website. And actually, our social media channels are constantly, almost minute by minute, being updated with that kind of information. So keep an eye out through those channels.
Great. Quick question for you, Viivi and JP, we can both weigh in. Just a little clarity on why you've decided to take everything out from behind the member paywall.
Well, to me, this is sort of an obvious thing. I think at this point we have to make sure that the public interest comes first. So I think that bringing everything forward is a way of arming our profession with the kinds of resources and information they need to carry on with practice. I think this is good for the public, and I think, of course, if it's good for the public, it's good for the profession.
Great.
Ditto.
All right. Just looking through them here. Sorry, guys. Wondering if you guys want to put on your fortune-telling hats and have a little bit of a conversation about what impact this crisis, including physical distancing and the fact that people are getting used to being at home and maybe not seeing their physio face-to-face. What do you think the impact will be on physiotherapy services in the future?
Okay, I want to go first.
Go ahead. You want it right in there.
I honestly, I've heard this from many of our component leaders, our division leaders, and our branch leaders. I think that this is going to open up opportunities. I think we're being given a chance to illustrate in real life, in real time, the value of physiotherapy. And so I think this is going to bode well for us. I think going into the future, I think the COVID infection and the pandemic itself is going to create a lot of demand for physiotherapy. And people are going to continue to have traumatic injuries, neurological insults, motor vehicle accidents. There's going to be, I think, increased demand once this curve flattens out. I think there's going to be a demand for acute care physiotherapy. I think there's going to be greater demand for outpatient physiotherapy. I think our case mix may be shifting. I think we may need to adapt private outpatient practices to being able to manage respiratory patients. I know many of them do already. I honestly think this is going to increase demand for physiotherapy services. As I mentioned also, there's some research starting to come out. It's very early days, so we can't consider it conclusive, but there's some suggestion that people are going to have perhaps cardiac effects from the COVID infection, in addition to all the respiratory effects. And people are being immobile. They're probably having exacerbations of other chronic conditions. So I think we're going to see increased demand. The challenge for CPA is to continue to push and pressure governments to consider this essential and achieve the funding that we need to pay for our services.
Yeah, I think, Viivi's hit on most of it. I think on that advocacy side, it's, we're making progress in some areas in terms of physio being able to, for example, like leverage telehealth more through the insurance companies. The federal government just recently announced that for its federal public servants, they were getting rid of the need for referrals for doctors to see physios. And it's things like that that we wanted to be able to push in and just make permanent moving forward. I think to Viivi's point, our Director of Policy and Research, Lisa Carroll, is starting to find initial research that is showing in areas where COVID-19 started before it popped up in Canada, is that you are seeing an increased need for physiotherapy. again, there's still more to do there, but one of the things we are trying to set up sooner rather than later is a looking forward piece to what could the system look like? We're going to have a new reality. I mean, that's just, I think that we're all agreed on that. When that happens, how long that takes, we're not sure. But we're in the kind of reaction mode right now, triaging. We are going to need to spend more time on what does this look like at the end and how do we prepare for this new reality.
And I've heard a couple of people also worry that if this tele-rehab thing is so successful, will there be demand for face-to-face physiotherapy? I don't think there's any concern whatsoever about the demand for face-to-face in live physiotherapy, but I certainly think that we will probably see telerehabilitation becoming a more normal part of practice. You know, telerehab has been available for a long, long time, and one of our physiotherapy experts in telerehabilitation said to me the other day that the biggest barrier to telerehab being broadly accepted is healthcare professionals being reluctant to use it. So now I think we will find much broader acceptance of telerehab. I hope that funding for telerehab will continue permanently, not just a temporary coverage, but I think it's going to be just part of the mix. You know, if you work in rural Newfoundland, telerehab is a lifesaver. If you have patients who can't drive, can't get to your clinic, telerehab is a lifesaver. So telerehab will be able to reach those patients you're not seeing right now. But I definitely think that face-to-face physiotherapy, it's not going anywhere when you think of all of the impairments that are going to be arising out of this crisis.
Yeah, and what I would add to that is that I think it's just a quickening of the curve getting to telehealth. I think we just need to be, there's going to be things we need to be careful of in terms of how we're costing fees, not rebating on telehealth. You're getting the same service. Again, I may be speaking out of turn with my advocacy team, and we're still developing some of these things, but it is you're getting physiotherapy, and there are certain things, to Viivi's point, that you can't do over telehealth. But I think it's an opportunity to kind of ingrain it a bit more as we move forward. So more to do there.
The next one isn't really a question, just want to address, there's some ideas coming up in the questions function. We've got Kareem is here. Hey, Kareem. Looking for webinars with tax accountants and business strategists. So we welcome all of that feedback and those ideas for how we can continue to support the member. And for anybody who doesn't have direct access to me the way Kareem does, you can send those kind of recommendations to information@physiotherapy.ca, and we'll track down the experts that you guys are looking for as we continue to roll out the webinar series. Go ahead, JP.
And I'm sorry to interject. Hi, Kareem. I would, on the telehealth, I would actually, if you haven't, check out just the one we had this past week, the PPD webinar. There was a lot of great nuggets from the panel on how they're using telehealth, what they're finding with it, the surprises they've had, both positive and otherwise. So I think I would strongly suggest you check out those webinars.
Great. All right, the next one's a big one, and I know one we've talked about a lot, the three of us. It has to do with the ethical concerns that we're hearing from the membership about providing urgent care, manifesting that with physical distancing, carriers having no symptoms, we're at the beginning stages of an outbreak. Maybe the CPA wants to speak to kind of where we're sitting right now on that issue, and if there's guidance that we can provide for members who are feeling that pinch.
I'll start. I think as a self-regulating health professional, I think each physiotherapist needs to assess their individual client's circumstances. So if you think that a client has an urgent need for physiotherapy, and there are a lot of regulators, public health agencies that have published guidance on how do you decide what's essential, how do you decide what's urgent. So for example, I have a patient who, if she doesn't get a walker and training with a walker, she's at risk of falling and ending up back in hospital. So I deem that to be urgent. Now, I work in home care, so I'm going to see her in home care. She just came out of hospital, so she's isolating for 14 weeks. She has no symptoms, and I know how to screen her. The public health agencies publish all kinds of information on how to screen your patients. If I need to put on personal protective equipment to see them, I will. So you need to continue to use your clinical judgment in terms of who needs to be seen and under what conditions in terms of personal protective equipment do they need to be seen. We can't give you a blanket statement saying don't see anybody in private practice or don't see anybody in their home. You have to continue to exercise your professional judgment, and you need to be able to defend that decision should somebody question it. So use all of the resources that are available in your province, your public health agencies, the Canada Public Health Agency. I know in Ontario, we have reams and reams of, patients, when should you see a patient, when should you use protective equipment, and so on. So get those resources. If you are having trouble finding those resources, let us know and we'll try to help you figure that out.
I think the only thing I would add to that is, again, I'm not a PT by any means, but knowing that PT is an essential service and there are urgent needs, there is going to be a point within, depending on what happens when we hit the peak around this, there's going to be a need for physiotherapists, whether through their clinics or more in hospital, to help offset those urgent care needs. So yes, there's a piece here around using your judgment, making sure you're doing the right thing within your clinic or otherwise. I think overall, public and private, there is going to be a point where we're gonna need everyone on deck, because we have that role, I think, to help open up space for doctors and nurses to do other things that physios can take off their plate. So I'm not sure if that helps add to that.
Yeah, I think that's a good one. We are getting ready to close up. So if anybody has any kind of last questions that they haven't seen addressed yet, there's quite a few of them in here still. So I'm gonna pick one or two just to close up. JP, can you speak to the recently, literally in the last few days, the public service healthcare plan suspended their referral requirement, doctor referral requirement? But it was a temporary suspension. So maybe you could give us a little bit of an update on that file.
Yeah, that one's interesting because in the work we've done over the last 6 months with the branches, the divisions, other components at large, that was actually one of the priority asks we had from an advocacy perspective. It is temporary, but we are already in discussions with the government about extending that in the medium term, and then making sure that becomes permanent as we move forward. So we'll be putting a fair bit of effort into making sure that doesn't go away.
Great. And one last question before I give you guys each a chance to kind of close up. Just wondering what the CPA is doing or considering doing, considering the financial implications on our members right now when it comes to, Congress renewals, membership coming up. We have a renewal period about to come up. So just if you could talk to that a little bit.
Yeah, JP, we're definitely thinking about that. That's a big concern. But there's a lot of ideas that we're discussing on how to ease the financial burden on members. And, we want new members to come on board too. And we're hoping that non-members who are watching this or watching our other webinars and so on, get a sense of what we can bring to them. But JP, you probably have a better idea of what we're considering.
Yeah, we're looking at everything right now in terms of, it's not just with CPA. We're in discussions with the branches around a coordinated approach with BMS around insurance. We know, again, I speak to we're not sure what the new reality is going to be, when that's going to happen, where people are going to be, 6 months down the road when we're in renewal. But we're looking at ways of easing that burden as much as we can to ensure that everyone still has access to the resources they need through CPA, and just be able to stay active. So we're we're working actively, not just internally, but with our partners to ensure that members are able to stay involved.
Great. We are having some very positive comments in the questions and answers. So thanks to everybody who is feeling well supported by the CPA. We are definitely here to work for you guys. On that note, anything that Viivi or JP that you'd like to close with?
No, I just really appreciate. I'm at the interest and engagement we're having from our members. I mean, this is a Sunday afternoon where I am. The sun is shining, so I'm just really appreciative that everybody's coming together. I think the more we as a profession are on the same page, working with unified efforts, the more effectiveness we're going to have, and the more results we can get going forward. I think this time of change is going to be ultimately good for our profession, even though it's a very unfortunate situation.
I'm going to encourage members, non-members, everyone within the profession to keep questions and ideas coming. I think to Chrissy's point earlier, everyone is experiencing this in different ways. They're seeing this from different perspectives. You know, when I spoke earlier about, I mean, most of my day, quite honestly, is with external partners and trying to link things, find different ways we can work together. Chrissy, who's our Chief Membership and Marketing Officer, I mean, she's got so much on the go with membership, marketing, comms. The more we hear from you, as much as it's a lot, the more we are able to use that to figure out, okay, here are things where we might be missing, things we need to be on top of more of than we are. So keep that feedback coming, keep those questions coming.
Awesome. So with that, on that lovely note of my boss telling me how great I am, we are going to bring this session to a close. If there are additional questions, we're getting hundreds of them by the day. Information at physiotherapy.ca. We're trying our best to get them answers to you within 48 hours. So definitely hit us up by email if you have any questions. I hope you guys found some value in this. I definitely did. And I want to thank JP and Viivi for being willing to have a discussion and be open with the membership. Again, if you want to find any of the resources that we referred to during this session, all of our information lives at physiotherapy.ca/COVID-19, or if you go to our homepage, there's a big COVID button to help get you to all of this stuff. And the last thing I would recommend is if you don't follow our social channels, that is where our updates are published the most, what our new webinars are, what the information is coming out of the federal government, all of those different pieces. So whether you're an Instagrammer or Twitter or on Facebook, that's probably the fastest way to get information from us. Although we are moving forward, we'll be sending out update emails to the membership on a regular basis. So thanks to both of you for being here, and thanks to everyone who joined in on a Sunday afternoon. As I said, Phil Shepard is hosting another Zoom webinar with Mike Sangster. So if you haven't checked those out, the PT Cross Canada series has been really great. So make sure that you head over there at 4 p.m. Eastern, and then we'll be back in touch during our next webinar. So thanks to everybody for joining.
Thanks, everybody.